Well, your community station partnering with MTV for Mental Health Action Day on May 15th, a day dedicated to turning awareness into action.
Yeah, every Thursday leading up to that day, your community station sing and celebrating people who are out there where we live working to support mental health right in our own communities. And this morning, the people who staff a call center in Santa Clara County are operating really are around the clock to help prevent further escalation and most importantly, to help people heal.
Yeah, Veronica Macias joining us live more to talk about this and give us some details on this team who go out and really go into areas that are sometimes not so safe, but they're taking about 600 calls a month, so doing a lot of work.
Right. And like you like to say, Reed, building bridges is what this team is really doing. I recently did a ride along with Trust, and it was really eye opening. We actually went to the encampment in San Jose where we just mentioned a police officer was stabbed. So it's proof of how important it is for this team to build relationships and identify areas of need. This program, it was all started for families wanting an alternative to police intervention to help people get the healing they need.
We got a call that this is
These women together make up a trusted team, trained to respond to stressful situations when emotions are high and overwhelming. They're dispatched to all levels of calls, from a nervous breakdown to helping share information and community resources. Lifting the dark cloud, Elise Malcolm says, starts with human connection.
in providing that empathy, we're able to show people that the light is still there, even though it might not be visible, and that we can navigate back towards it together.
The Trust Mobile Response Team was formed in Santa Clara County from a community's call to action to help prevent low-level behavioral issues from escalating into more drastic situations. It's an alternative to police involvement for those seeking help.
A lot of law enforcement officers utilize Trust frequently. They activate us to come out and provide support and care within the scope of behavioral health because they are aware themselves that they are there to address crime and imminent threat. And when it comes to somebody that might be anxious or depressed or overwhelmed, that's not necessarily a call for law enforcement. So we are not just a resource for the community, but also for our fellow first responders.
A Trust Mobile Response Team is made up of a crisis intervention specialist, a first aid responder, and a peer support specialist, which is someone who can relate to a trauma situation through their own life experience. Encampments in the area can be hot zones for calls, but Trust serves people from all walks of life.
Just not to unhoused individuals. We go to families, regular people on the street that you see walking next to you every day. I mean, it's everyone. It's moms, it's dads, it's grandparents, it's aunts, uncles. It's everyone.
Understandable. We do have some resources that can help support you.
Each incoming call is evaluated. Information is taken down and a series of questions are asked about each situation. And while not every call may feel like they've helped someone turn a corner, they'll always leave knowing they've built a bridge to help someone on a new path.
Because sometimes in our own minds we don't think that it maybe wasn't as successful as we would have liked it to have been. And then that's when the team is able to talk about like things that they can do either next time or what we can do when we're following up with the client.
And the number of calls are growing. From March to August of 2024, Trust responded to over 2,100 calls, with more than half requiring direct in-person intervention.
Being able to be there and help the community has been very rewarding and makes us, want to come to work every day and love what we do. So.
Especially we all live here too. A community in which you live, it's like we're all community members here to support one another. It's like you're really not alone.
That interaction that our team has with individuals in the community, that's where it starts. That's where the healing starts and the trust starts as a whole. And it's working. It's really working.
The program made possible thanks to nonprofits Momentum Health and Pacific Clinics. Malcolm also tells us that if you see someone who might be hurting or they're not hurting anyone, not committing a crime. You can definitely see, though, that they are in need of help. Something's wrong. Trust, it's a great place to start. You would be helping by providing access. And at the end of the day, access, they believe, saves lives. If you or someone you know is struggling with suicidal thoughts, or you just need someone to talk to, you can call or you can text the National Suicide and Crisis Lifeline at 988. It's available 24 hours, 7 days a week. And Thursday, May 15th, is Mental Health Action Day. So join CBS Bay Area News and MTV by taking action for your friends with ASK, which stands for Acknowledge, Support, Keep in Touch with Your Friends who need you as much as you need them. Learn how to ask at mentalhealthishealth.us.